Vigadrone 500 mg tablet is an anticonvulsant medication used in combination with other medications to treat seizure disorders, also known as epilepsy. It helps decrease the number of seizures in both adults and children who have not been able to control their seizures with other treatment. The medication works by stopping the breakdown of a natural calming substance called Gaba in the brain. It is important to take this medication as prescribed by your doctor, usually with or without food, and at the same time each day to get the most benefit from it. Before taking Vigadrone 500 mg tablet, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice a day. The dosage is based on your medical condition and response to treatment. For children, the dosage is also based on their weight. Your doctor may start you on a low dose and gradually increase it to lower the chance of side effects. Your doctor will adjust your dose to find the best one for you. Take this medication regularly to get the most benefit from it. It's best to take it at the same times each day. Do not increase your dose or take this medication more often than prescribed. Your condition will not improve any faster, and the risk of serious side effects may be increased. Do not stop taking this medication without consulting your doctor, as your seizures may become worse if the drug is suddenly stopped. Your dose may need to be gradually decreased. If your seizures worsen or have not improved within 3 months, be sure to tell your doctor. Some common side effects of Vigadrone 500 mg tablet anticonvulsant, Gaba modulators include drowsiness, dizziness, difficulty concentrating, nausea, vomiting, stomach upset, diarrhea, headache, weight gain, and tiredness. Children may become restless or excited. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. It is important to note that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. However, if you experience shakiness, tremor, swelling ankles/feet, tingling/numbness, shortness of breath, or fast heartbeat, it is important to contact your doctor immediately. A small number of people who take anticonvulsants may experience depression, suicidal thoughts/attempts, or other mental/mood problems. It is important to seek medical help if you or your family/caregiver notice any unusual/sudden changes in your mood, thoughts, or behavior. While a serious allergic reaction to this drug is rare, it is important to seek medical help immediately if you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it is important to contact your doctor or pharmacist if you notice any other effects not listed above. If you are in the US, you may report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you may report side effects to Health Canada at 1-866-234-2345. It's important to note that serious vision problems may occur while taking Vigadrone 500 mg tablet, and these problems may be permanent even after you stop taking the medication. To prevent vision problems from worsening, your doctor should identify any eye issues as early as possible. If you have a history of vision problems, be sure to inform your doctor. It's crucial to have an eye exam before or within 4 weeks of starting this medication, then every 3 months while you are taking it. You should also have an eye exam 3 to 6 months after stopping the medication. Make sure to follow your doctor's instructions carefully and attend all medical, eye, and lab appointments. If you experience any changes in vision, such as loss of vision, blurred vision, double vision, sensitivity to light, or eye pain, be sure to inform your doctor right away. In the United States, you must understand, agree to, and carefully follow the requirements of the Vigadrone REMS program in order to receive this medication. If you live in Canada or any other country, consult your doctor and pharmacist for your country's regulations. Before taking Vigadrone 500 mg tablet, it's important to talk to your doctor or pharmacist about any allergies you may have or if you have any other medical conditions. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. It's also important to inform your doctor or pharmacist about your medical history, especially if you have any eye problems, mental or mood disorders, kidney disease, or low red blood cell count. It's important to note that Vigadrone 500 mg tablet may cause dizziness, drowsiness, or vision problems. It's advised to avoid alcohol or marijuana as these substances can increase these effects. It's also important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. If you have an infant who is going to have an MRI test, it's important to notify the testing personnel that your infant is using this medication, as MRI tests have shown changes in the brain of infants after they are given Vigadrone 500 mg tablet. It's important to consult your doctor for more details on this matter. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's also important to discuss with your doctor if you are pregnant or planning to become pregnant. It's advised not to become pregnant while using Vigadrone 500 mg tablet, as it may harm an unborn baby. Reliable forms of birth control should be discussed with your doctor while using this medication. If you do become pregnant, it's important to talk to your doctor right away about the risks and benefits of continuing this medication. This medication also passes into breast milk in small amounts, so it's important to consult your doctor before breastfeeding while using Vigadrone 500 mg tablet. It's important to be aware of potential drug interactions with Vigadrone 500 mg tablet anticonvulsant, Gaba modulators. This medication may interact with drugs that can harm the eye, such as chloroquine and hydroxychloroquine, as well as certain antihistamines and drugs for sleep or anxiety. It's important to talk to your doctor or pharmacist about any other products you are taking that cause drowsiness, including alcohol and marijuana. Additionally, be sure to check the labels on all your medicines, as they may contain ingredients that cause drowsiness. It's also important to inform your lab personnel and doctors that you are taking this medication, as it may interfere with certain lab tests. If someone has taken too much Vigadrone and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, while in Canada, you can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing and loss of consciousness. It's important to note that Vigadrone 500 mg tablet anticonvulsant, Gaba modulators should not be shared with others. While taking this medication, it's recommended to undergo lab and/or medical tests such as eye exams, kidney function, and complete blood count. It's important to keep all medical and lab appointments and consult your doctor for more details. If you happen to forget to take your dose at the scheduled time, take it as soon as you remember. However, if it's almost time for your next dose, it's better to skip the missed one. In that case, just take the next dose at the usual time. Avoid taking a double dose to make up for the missed one. It's important to store Vigadrone 500 mg tablet anticonvulsant, Gaba modulators at room temperature, away from light and moisture. Keep them out of the bathroom and away from children and pets. When it's expired or no longer needed, make sure to properly discard the product. It's best to consult your pharmacist or local waste disposal company for guidance on how to do so. And remember, don't flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.